Good afternoon. I'm Jung, a student nurse at Western Sydney University. My student ID is 1946 1742. Today I'm doing a health assessment videos and I'm playing a role of nurse and she'll be playing the role of my patient. So, okay. Good afternoon. I'm Jung. I'm your nurse today. How are you today?
Good afternoon. I'm good, thanks. And you?
Yeah, I'm fine, thank you. So, Mr. Bruce, I'll be asking you a bit of questions, in between the interview time. So, are you happy sitting here?
Yeah, I'm fine with sitting.
Yeah, the interview might take around 10 minutes. In between that, I'll be taking some notes. Is that okay with you?
Yeah, it's fine.
Okay, Mr. Bruce, how you want me to call you about your first name or your last name?
Yeah, first name Bruce is fine.
Okay, so can you just confirm me your name, date of birth, and address?
Yeah. My name is Bruce Alcredi and my date of birth is 14 May 1953 and my address is 47 Leafy Avenue, Broadfield, and my postal code is 2173.
Okay, thank you, Bruce, for your details. So, Bruce, do you have any known allergies?
Yes, I do have allergy with surgical tape.
Okay, I'll note down for you. So, Bruce, can you tell me what brings you here today? Like any particular health issues that brought you here today?
I have developed deep gestica like a few weeks ago, and
Yeah.
I feel like tired and having stress in my life. So that's why I want to see the way to improve my health.
Okay, so are you taking any sort of medications?
No, not at all.
Okay, can you tell me about your work life? Like what sort of work you do?
Yeah, I just recently
Yeah.
retire and look after my grandchildren in the afternoon and to help my son out. However, I used to work as a manager at a supermarket.
Okay, Bruce. So can you tell me about your family circumstances, like about your wife and children, about your living arrangements?
I separated from my wife, Lauren, 2 years back, and I have got a son whose name is Mark, and whose wife died of breast cancer, and he has two children. One is Lily, which is 12-year-old, and Ben, which is 5-year-old, who I just look after at afternoon to help him out.
Yeah.
And I live myself in two-unit bedroom at 47 Leafy Avenue by myself, which is just 2 minutes away from my son. Yes.
Okay, I'm so sorry to hear about your son's wife. So anyway, are you taking good care of your grandchildren?
Yeah, I just take them for a walk in a park,
Yeah.
which is nearby my house.
Okay, Bruce. Look, I got your vital sign report, and there are a few, area of immediate concerns. Like the first priority goes to your respiratory rate. So that's 24, which is no higher than the normal range. And your oxygen saturation level is 94%. That's lower than the normal range. And another important factor of concern is your blood pressure, which is 184/70, which is also quite higher than your normal. So straight away after the interview, what I'll do is I'll book you to see GP, and he will further assess you with your health conditions and if any medical intervention is required.
Okay.
And what I've found is even your weight, which is 105 kilos, and your body temperature is 37.9, that's higher too, So that's might be the reasons you might have a bit of infection. And we'll further discuss about it. So, Bruce, now we'll discuss further more about your things related to your health and lifestyle,
Okay.
which will help me to identify like any issues about it.
Yeah.
So, can you tell me what sort of diet do you take?
I mostly buy a meal, and I'm not good at cooking. And normally, most of the time, I skip my breakfast and frequently buy a takeaway such as pizza and burger
Yeah.
for my lunch and dinner.
Look, what I can see is you've been taking a lot of takeaway foods. As you know, takeaway foods have a high amount of saturated fats, and it doesn't have any health benefits. That means, are you open to recommendation and suggestions I want to give you related to your diet?
Yeah, definitely.
Okay, so I'll give you some recommendations after we finish this interview, so they'll help you out.
sounds good.
So moving on, can I ask you about your alcohol consumption? How often do you drink?
Mm-hmm. I drink around 6 to 10 is standard, like beer and wine in every evening,
Yeah.
as well as I drink with my friend when I go out.
And may I ask you, do you smoke at all, or how much cigarettes do you smoke?
Yeah, I'll do smoke like almost like 30 cigarette a day, and maybe even more when I go to with my friend to the local pub.
That's a lot of smoke. So now, Bruce, can you tell me, do you do any sort of exercise?
For exercise, the only thing I do at the moment is to go for a walk with my grandchildren on to the local park. And other than that, I do a bit of swimming
Yeah.
when it's time for swim.
That's really good. Have to keep it up.
Mm-hmm.
So, okay, Bruce, can you tell me a bit more about your cultural background and your religions?
I am Australian Aboriginal
Mm-hmm.
and Baptist Christian by religion.
Okay, so are you connected to any communities or religions? Like, do you take part in any or spiritual
Yeah.
activities?
Well, I do go and attend the Aboriginal with program with
Yeah.
my grandchildren on Sunday, and sometimes I go to the local church, Baptist church.
Okay, Bruce. So look, I just want to confirm the details you have gave it to me.
Mm-hmm.
So what I can see is you have developed a very deep chesty cough in the last few weeks. You know, you don't take any medications and you don't have any allergies,
Mm-hmm.
and you're allergic to the surgical tape.
Mm-hmm.
You mostly buy takeaway foods and you skip your breakfast,
Mm-hmm.
and even you have takeaway food for your lunch and dinner.
Mm-hmm.
And you smoke a pack of cigarettes of 30 cigarettes a day, and you drink around 6 to 10 standard
Yeah.
drinks. And you normally go for a walk to your local park and attend your community youth program every Sunday.
Mm-hmm.
Is that all correct?
Yeah, that sounds correct.
Okay, so Mr. Bruce, on my side, I would suggest you first of all, like with your diet,
Mm-hmm.
since you're taking a whole lot of junk foods, takeaway foods has a whole lot of saturated fats.
Mm-hmm.
So first, you have to minimize uses of takeaway food. Instead, you know, you can have fruits, a bit of cereals
Mm-hmm.
in the morning. Whereas for your lunch and dinner, you can go for the foods that take very minimum time and non-cook skills is required,
Mm-hmm.
like the stir fry veggies and a bit of extra chicken and all. And what I can do is, since your most of the health issues are related to your diet, I'll refer you to a dietitians, and they'll help you out to and recommend you how to cook and how to have a healthy food.
Mm-hmm.
Whereas with your drinking habits,
Mm-hmm.
you drink around 6 to 10 standard drinks a day, and might be more when you're with your friends. As per the Australian standard drinking, is only two drinks, and this, since you're taking high amount of alcoholic drinks, it increases your blood pressure.
Mm-hmm.
That's why you have high blood pressures.
Oh.
And to help you out, what do you have to do? Whether drop it down with 2 drinks, you can even ring to the helpline center.
Mm-hmm.
They'll help you out
Okay.
and minimize to your alcoholic drink to a non-alcoholic drink.
Cool.
And
Yeah.
with your smoking habits, you've been taking more than 30 cigarettes a day. That's a
Yeah.
lot of smoke. So instead of, you have to cut down your number of cigarettes. You can even try for nicotine patches or nicotine chewy, or you can even ring to the quit line,
Mm-hmm.
and they can help you out, because your respiratory rate is very low, very high,
Mm-hmm.
and you got a deep chesty cough is because related to your smoking habits. So you
Oh.
have to give it up
Okay.
to improve your health.
Yeah.
Also, I encourage you to continue to go to your community youth program,
Mm-hmm.
because the more time you spend there, it helps you to reduce your stress level
Mm-hmm.
and read books.
Mm-hmm.
And with your exercise,
Mhm.
since I know you go to the park for a walk, but I would still recommend you to go to a gym, do more a bit of extra exercise and all.
Mm-hmm.
So, okay, Bruce, what about if you try my suggestions for upcoming 4 weeks time and see how you go?
Sounds great. Yeah.
So
I love
okay,
that.
all right, okay, Bruce. Is there anything else I can help you with?
No, I don't have more questions.
Okay, what I'll do, I'll book a follow-up assessment in 4 weeks times, and now I'm booking an appointment with the GP. Does it sounds good to you?
Yeah, that's great.
All right, Bruce. It was nice meeting you. Have a great
Thank
day.
you.